Okay, good morning. Welcome, everyone. Welcome to our latest Micro Summit, brought to you by, powered by the Council of State Governments, Council on Communities of Color. It's actually more specifically the Council of State Governments Eastern Regional Conference, Council on Communities of Color, and also Healthcare Ready as well, partnering up to bring you this third Micro Summit. We've been doing a series of Micro Summits on issues relevant to underserved, vulnerable communities who are going through this pandemic crisis that we're all going through. We really appreciate everyone joining in. We've got a great lineup of panelists for you this morning. Really appreciate people taking time out of their mornings this Friday morning to see this conversation, to get these insights, to also listen in on this analysis as we talk about COVID communications or public health crisis communications during a time of pandemic. How are you all doing? Good morning. I'm Charles Ellison. I am the moderator for this event. Also, I am host of Reality Check, a daily public affairs program on WURD Radio, which is based in Philadelphia. However, I'm based in Washington, D.C. I'm also sort of the one-man D.C. bureau for WURD as well. So you can go to WURDradio.com. For more there, that's every Monday through Thursday, 10 a.m. So I'm off on Fridays, and on Fridays we do micro summits here, once again being powered by CSG East and also Healthcare Ready. For more information on the Council of State Governments Eastern Regional Conference, you can go to csg-erc.org. During the course of this conversation, we want to learn more about them. For Healthcare Ready, to learn more about them, what they're doing, how you can connect with them and learn more about how you can tap into the healthcare supply chain to get supplies and resources during this crisis, go to healthcareready.org. Feel free to also share your thoughts on this conversation as it's happening in real time on social media, especially Twitter. Go to hashtag CSG COVID-19 and hashtag healthcare ready, hashtag healthcare ready, and or hashtag CSG COVID-19. I'm at Ellison Report for me directly. If you'd like to engage me, you have questions. Also, before we start, just want to let everyone know, all those audience members who were, I'm seeing many of you coming in right now. If you have questions or if you have comments or feedback during the course of this discussion, leave them in the Zoom group chat at the bottom right-hand corner of your screen. That's how we will be fielding questions. We're going to open up the floor in about 30 minutes for those questions, but leave those questions and comments too in your Zoom group chat at the bottom right-hand corner of your screen. That's how we will be accepting and fielding questions for the panelists, for the experts joining us here today. So let's get that started. I'm going to go ahead and introduce our panel of experts today. Joining us, you see him to the left of your screen, is State Senator Vincent Hughes. He represents Pennsylvania's 7th Senatorial District, covering vast parts of Philadelphia and also Montgomery, neighboring Montgomery County. You can go to senatorhughes.com for more information. Senator, thank you this morning for joining.
Good morning. Thank you,
appreciate it. All right, good morning. Also to your right, right next to him is Dr. Nicolette Lewis-Saint. She is Executive Director of Healthcare Ready. Go to healthcareready.org for more information. Also, you can reach her on social media more directly at Dr. N. Lewis-Saint. She's engaged as much as she can be. She's very busy these days. That's why I really appreciate her time this morning. But she joins us as well, and she has expertise in pandemics and in outbreaks, dealing with this crisis and also dealing with Ebola before in the Obama administration. Hi there, Nicolette. How are you doing?
Good morning. Thank you for having me.
Good morning. Good morning. Also to the bottom left is Dr. Ivan Walkes, the former Chief Medical Officer, Chief Health Officer for the District of Columbia. That is the city-state hybrid government for Washington, D.C. You can also check him out. He is the founder, principal of Ivan Walkes and Associates. Go to ivanwalkes.com. Dr. Walkes, how are you doing, sir?
Good to be with you, Charles, always.
All right, always good to be with you as well. Tara Dowdell is founder CEO of the Tara Dowdell Group. Go to taradowdellgroup.com for more information. At Ms. Tara Dowdell on social media, and also a longtime communications political strategist. You see her occasionally on MSNBC and other places, as well as Reality Check. All of you have been on Reality Check on WURD, in fact. Tara, how are you doing this morning?
I'm doing very well on this rainy morning here in New York.
Right, exactly. It's rainy all across the Northeast. So definitely appreciate everyone tuning in. Well, you didn't have to go through any rain to get here.
Right.
So I hope all the panelists and all the audience members, I hope you all are safe, and I hope you all are healthy as well. Let's get this started. Senator, I'm going to start with you real quick. What's crisis communications been like? So you're an elected official. You're in the, in the eye of the storm, so to speak, as far as trying to message with your constituents. You're trying to also inspire confidence and calm with them, while at the same time disseminating real crucial information. You've been holding quite a bit of webinars and teletown halls, it seems like daily. What's that experience been like?
Wow, it's well, hello to all my panelists. And Charles, it's good to talk to you again. I think it was yesterday at this same time we were on the radio together. And so look, I just
that's right.
What folks seem to be looking for, what folks are looking for, I think, and I go with a phrase that stands true: trusted messengers delivering trusted messages. Trusted messengers delivering trusted messages. We cannot escape this conversation without talking about where we are juxtaposing what we do. Local elected officials, folks like that are on the panel, yourself, you juxtapose what's coming out of the White House. Not a trusted messenger delivering really, really bad messages. I mean, yesterday's was maybe the worst with the disinfectant conversation and that kind of piece. And so that's, as an elected official, I got to look at what the backdrop is, okay? If this was Obama, I'd be operating completely different, okay? But you have a situation where you have the senior message giver for the nation and maybe for the world, all right, giving out bad messages, and he's not a trusted messenger. So what we have done is ramped up on every platform that is available to us. So robocalls, Zoom virtual conversations, this kind of stuff, everything, regular e-blast, providing good information, trusted messages, and utilizing also trusted messengers. Every conversation that we do, we have a physician also on the line with us, okay? And we've been really pushing hard on Black doctors and getting them out there and utilizing. They have not pushed back. They have been fabulous. They've been engaged. And we also try to focus on the issue at the moment. So the thing that people are listening for right now seems to be always good information on the health aspect of this pandemic, always having someone there, but also what they're looking for, that corona check, okay? They're looking how to get that unemployment compensation. They're looking at how to get access to the small business loans. So that's what the message is at this moment, and that's what we focused on. For example, last night, we did a telephone town hall. We had, for an hour, we had close to a total of 2,000 people within that hour on that call. It wound up with about 400 as we end, still on the call. Focus was on how to get your corona check. We had someone from the IRS, okay? How to get your corona check, how to get your unemployment compensation. We had someone from the state of Pennsylvania's Bureau of Unemployment Compensation. Trusted messengers providing trusted messages. And especially important with the anxiety level being so high, that you got to get good people. And I also believe especially important to the repetitiveness of the messaging, okay, is important because there's so much stuff coming at folks, especially online, especially on email. So we're repeating it, using every format, building on every format, from telephones to email blasts to text messages and everything like that, making sure that it's complementing one another. And it seems to be getting through.
All right, and you're coming from an elected official's perspective, Senator, and Dr. Lewis Saint, want to talk about that medical epidemiological perspective that you bring to the table and what that conversation has been like. Talk about the challenges, how you've been doing a lot of media as well, especially a lot of local media, whether it's WURD or in other markets. What's that conversation look like for you? What are certain elements of it that you need to tailor sure that it's effective and that it's, as the senator is just saying, it's reliable, it's trusted?
Sure. So one of the difficulties in explaining a pandemic of what we call an emerging infectious disease, something that is new, something that hasn't been in the population before, is that the disease is spreading faster than the science can catch up. And so part of what we always have to do is make sure that we are communicating in a way that is explaining what we currently know, but also communicating that as it evolves, that we're going to learn more, that the situation may change, the best practices may change, just simply as we are getting more information and learning more science about the actual pathogen. So that's part of it. And when you especially think about the communities that have been hardest hit, the history of uncertainty and mistrust can actually counter how we do the communication as it relates to the evolving science. So that's one part of it. The other is that from a health and medical perspective, there is what we need to focus on as it relates to the exposure and to the prevalence of existing chronic diseases that exacerbate COVID. But there's also the recognition that there are existing health challenges and more importantly, existing health disparities that exist as it relates to the communities that we are most focused on, and as a result are most vulnerable to fatality related to COVID. So it's not just about how do we explain COVID, it's also how do we ensure that we're explaining continuing diabetes treatment in the presence of COVID? How do we make sure that people can get to dialysis and not see that they're not able to get to their dialysis center because they're afraid to leave their house or don't have the ability to use public transportation to get to their dialysis center? So it's not just the one message as it relates to health and continuity of care, as we call it. It's both of those.
Dr. Walks, I want you to jump in here. I'm going to get to you as well, Tara. Dr. Walks, what are features of this crisis right now? Because you've been through a few crises. I remember I was on your team. You're my former boss when anthrax hit, the first bioterrorism attack in U.S. history. And so and you've been through some other crises and emergencies as well, public health emergencies. And what are features of this that are similar to those previous crises? What are features of this that are very different from which you've experienced in the past? How much has this rewritten the public health crisis communications playbook?
Charles, thank you for having me. I feel like that old bicycle that gets pulled out every spring. And I forget about it in the wintertime. There are so many answers to your question. Let me focus on just one little piece of this. We kind of act, when I say we, I mean America, we kind of act like it's a surprise every time something happens that particularly hits communities of color. It's like, oh, wow, what? Mm-hmm. Well, nothing happened, and that's the problem. Nothing happened. We continue to under-resource our communities. We continue to under-inform our communities in a way that they can accept the messages. We go back to something the senator said that it was just perfect. Senator, you said that you had this town hall and you had the IRS people on there, and you talked about trusted messengers bringing a trusted message. Hey, the IRS is not a trusted messenger in our community. When they're on with the senator, suddenly they become a trusted messenger because he is that cultural guide that we talk about. He's the one that's trading on his credibility to bring them in. So it's that bridge building that the senator is demonstrating that can rehabilitate someone who we may not trust in our community. But that bridge building has to go both ways. The IRS has to reach out to people like the senator, people like Dr. Saint, people like all the folks on this panel who already have that credibility, so that we as a community will say, oh yeah, they're coming in with somebody we know. We'll let them in. This is no different than you going into a different neighborhood when you're growing up. You better come in with somebody you know. So think that it's understanding our community, understanding our history. When I had to deal with anthrax in DC, what did I hear from people in my community? Oh, this is like Tuskegee. Like, what are you talking about? Well, no, people remember that there was a time when our government experimented on us. I had to explain, to be just perfectly candid, why the white folks got Cipro and the black folks were getting doxycycline. They didn't want to hear about, well, the science is different now. We understand more now. And so it's the same. You're going to be just, people need to understand that their messengers have not been co-opted, are bringing them stuff they can understand. And as my mom told me a long time ago, if you honestly come and tell people when you don't know stuff, they'll believe you when you come back and tell them you do know stuff. And that's to the point about the science changing. That's to the point about, but let me jump to the way forward real quick. I know there's, and Charles, I apologize, it's your fault. You know, I talk a lot. Let me jump to the way forward. The way forward is that we have to ensure that this time, the elected officials, the ones who aren't as connected as the senator who's on this call, that they don't forget about us after this, that they remember that they reached out to us and we reached back and we're helping them get the message out. Because when I had to deal with treatment-resistant tuberculosis in West Los Angeles and nobody cared because it was only hitting East LA, you know what my message was to the other people? I said, oh yeah, it's not hitting your community. Oh wait, who gets off the bus at the gate to your community and comes in and takes care of your kids and cleans your house? All of a sudden now, they were concerned about the fact that, wait a minute, it's communicable and it can come through the gate if somebody's bringing it through. We have to make sure people understand that as we're driving the bus, as we're working in those grocery stores, and as we're delivering their food, that they recognize if they don't take care of us, they're putting themselves at risk. I don't mean to sound cynical. I've been.
No, that's a really good point. I'm gonna have Tara jump in here too. Now, Tara, you've been dealing with a number of clients. All of you on this panel have been very busy dealing with specific populations. Tara, you've been dealing with a number of climate clients, and you're at that intersection of, you know, doing communications, professional communication strategy for clients, but also giving them advisement and guidance on speaking with unique populations or populations that are uniquely situated. Because we talk about crisis communications as a whole, but we have to understand that it's a very different kind of playbook when we're talking about diverse, traditionally or historically underserved Black and brown populations, et cetera. What are the tools that you're advising people they need to rely on at a moment like this? What are those effective tools and strategies or techniques, or you know, special artwork or art that they need to utilize or employ in a crisis like this?
Well, I will say, first of all, the fellow panelists have done an amazing job of explaining a lot of those tools already. So I don't want to take up too much time just reiterating what's been said. But what I will say is there are a few key things that I want to punctuate that's already been stated. Number one, actionable information. Don't waste people's time. If you're going to have a panel discussion, if you're going to have a webinar, if you're going to have a micro summit, there needs to be actionable information that people can walk away with and then implement. So that's important. So the IRS, as Senator Hughes, having someone from the IRS on the call, walking people through the process, that is worthy of people's time, because I've been to a lot of these, I've been on a lot of panels, I've been at webinars, and you get a lot of information that is broad and general and cliche almost in many ways. And so I think that's a really important fact. Another piece is combating the misinformation, just addressing it head on, because there's a ton of misinformation out there, particularly on social media. And then of course, as was stated earlier, the president of our country is one of the biggest purveyors of misinformation. And that's powerful. Even if you don't trust him, it gets taken, the information gets taken, it goes to the media, and sometimes there'll just be a headline that quotes him. And so in the absence of reading that article, and people are busy, people are struggling right now. So in the absence of reading that article, it could look like fact-based information because it's in a publication. So combating that misinformation up front as well is really, really important. And then transparency, as was mentioned earlier, just want to punctuate that point, being honest with people. If you don't know the answer, you don't know the answer. Tell them we don't know the answer, but we're fighting to get the information for you. I do want to point out while this is a terrible situation and people are struggling, I want to point out that while we have challenges, we are also presented with opportunities from a communication standpoint. And so what we're seeing is a lot of our clients, so I run a socially conscious marketing and PR agency. So our clients are only folks who are working with primarily vulnerable populations. So our clients that are working with small businesses, for instance, those small businesses are 90% communities from communities of color and 70% women. And so when we look at that population of small businesses, that is a very different population of small businesses than what we're hearing people talk about in the mainstream. And you made the point earlier, someone made the point earlier, and it was an excellent point. And what's happening to those small businesses, and small businesses in general, but what's specifically happening to Black-owned businesses, of which I am a Black business owner, obviously. What is happening is what always happens to us. This is not new. The disparities that exist, the racial wealth gap that exists is basically the same dynamic we're seeing now. We've always struggled to access capital. We've always struggled to get the resources that other more advantaged businesses get. That's an ongoing dynamic. The racial health disparities that are being put on Front Street yet again, these are ongoing racial health disparities. So what is the opportunity? The opportunity is to use the media focus now to take advantage and leverage. It's up to our policymakers, it's up to those of us who lead organizations to then use this opportunity. And the media is paying attention and asking questions that they haven't asked before under normal circumstances about the issues that have always existed, right? But now there's a spotlight. So it is our task to take the opportunity to put the pressure on the policymakers, to put the pressure on the banks. For instance, one thing with the banks is I had this conversation with a member of my team yesterday who's probably listening right now. When you look at the banks and the money, the PPP, the Paycheck Protection money, right? When you look at that money for small business owners, if you don't have a relationship with one of the banks that's been certified by the SBA to give that money, you're not getting that money. So there's a lot of Black business owners that bank with credit unions. And so one thing we've been talking about is if you are a small business with 20 or fewer employees, of which a lot of Black businesses are, we should not be competing in the same pool as a 500-person business. It's just simply, otherwise we're gonna continue, we're on a hamster wheel with this policy making. The banks did what was rational for the banks, right? They are banks. They're gonna do what banks do. What they did was, we're gonna take care of our best customers. We're gonna take care of the people that have given us the most money. So the only way to change that is through government policy and action, period. And so that's the opportunity to highlight these flaws in the system under a microscope, under a spotlight that didn't exist and will not exist again until the next crisis.
If you're just now listening in, if some of you are just now coming in as audience members, we are convening our COVID communications panel. This is called COVID Communications, how you talk with audiences, with constituents, with the public during a pandemic. Especially, we're focused on underserved, diverse, vulnerable populations during a time like this. But there's been a lot of discussion, a lot of headlines. I wrote about it in the Grill myself this week about how COVID-19 is hitting Black populations the hardest. How do you communicate with those populations when they're under such stress, when they're feeling so targeted by this virus in this time? We have State Senator Vincent Hughes of Pennsylvania. He's been joining us. Also, Dr. Nicolette Lewis-Saint of Healthcare Ready, Dr. Ivan Walks and Associates, former Chief Medical Officer at the District of Columbia, and also Tara Dowdell, Communication Strategist, Political Strategist, a principal founder of the Tara Dowdell Group. Debbie Ann Page is also want to thank Debbie Ann Page, by the way, for facilitating this, Senior Policy Director at the Council of State Governments Eastern Regional Conference, Council on Communities of Color, who is powering this micro summit in partnership with Healthcare Ready. Go to csg-erc.org and also healthcareready.org as well. We're gonna, if you go to the bottom right-hand corner of your screen, there is a Zoom group chat. I'm inviting audience members to now submit their questions or their comments. I will read them out loud and pose them to the panelists. We're gonna continue with the discussion. I'll be looking at the Zoom group chat in a few seconds and fielding your questions as audience members. Really want to thank everyone for joining us this early Friday morning through the rain. There's a lot of rain for many of you. And once again, just hope everyone is staying at home, they're keeping safe, and they're staying healthy as well. That's very important. So I'm gonna throw this question out to just everyone. The panel, you can just sort of jump in wherever, whomever can jump in. So, you know, to Tara's point, do those various stakeholders, do they understand this? And this is a real good question for Senator Hughes as well, because, you know, you're dealing with city, state, federal, and also corporate, private stakeholders, various institutions. And you've got to, I'm wondering, do they see that, oh, hey, you know what, you've got these much more impacted populations, much more frustrated and anxious populations over here, Black populations, some brown populations as well. Do you understand that they've got very specific, unique needs that your model may not fit with their needs or their demands? And are they willing to create, like, what, you know, even if it's on the fly, but willing to put in the time and create a new model to help tailor that messaging and to help adapt to those needs? Go ahead. I'm just going to throw that out there. Senator, you can jump in, and anyone else can jump in on that too.
I'll start and then open it up. So, and this may answer a couple questions that may have been in the chat and that you just asked, Charles. I used yesterday as an example. As you know, we did a noon webinar with the African American Chamber of Commerce of Philadelphia, excuse me, some other organizations, and a group called Lendistry. Lendistry, different than the traditional banks who just did what they always do. Okay, Lendistry has been selected as a CDFI, Community Development Financial Institution, to focus specifically on distressed communities. In this case, we're talking about ours. All right. And they know how to communicate with Black folks. They know how to communicate with Black businesses. They've been doing it. And then they have a capacity to get dollars to our business folks that the traditional banks choose not to. And so trusted messenger, trusted message. But in the conversation, as we were winding up, after about an hour's worth of dialogue, I asked everyone to seize this moment as an opportunity to learn from what wasn't working over here, to figure how we apply it over here. There will be a need to be a push from legislators across the country, all right, Black legislators across the country, to go for more resources specifically for our community. We need to use moments to learn to build, okay? How do we make, this was a failure over here, how do we take something creative and new and drive it over here when we come back at this thing again? Because I've listened to enough doctors and the good ones, like the two on the phone right here and a whole bunch of others. This thing ain't going anywhere anytime soon, all right? Given the behavior that we're dealing with from some of our wrong-minded colleagues, okay? And I'm being polite. There will be a surge, okay? And it's gonna come back and it's gonna hurt us and it's gonna be terrible. What are we learning? What are the instructions to inform us how we go forward, and engaging Black business folks to be engaged and involved in public policy conversation and in the political conversation? You cannot think you're going to get something over here by being disengaged over here. All right, and that's something that we've got to learn and develop more within our community.
Let me also jump in on this, Charles. I think that sometimes we don't understand that business and health are related. They're absolutely related. This is a pandemic. It's a health crisis, but where is it hitting us? It's hitting us in our businesses. And so we have to as business people, we have to remember that the health of our community, especially if we work a lot in our community. I run a core service agency in Washington, D.C., takes care of the most vulnerable people in the District of Columbia. And if those folks are afraid to come out, oh, and by the way, they can't get on Zoom because many of them don't have the resources to get on Zoom. They don't have those computers. They don't have that internet access. There's a lot of interrelatedness in our community. If we recognize that, and as the senator is saying, we work across and include our community, we can make some changes going forward.
We have actually as a conversation, and feel free to jump in on that question, but I want to field some questions from the Zoom group chat. Ryan Mast, who I believe is the director of environmental health out in New Mexico in Albuquerque, as a public health official, says, Ryan, how can we best engage with our elected community and faith leaders and long-term response recovery actions, noting the compounding adverse effects of COVID-19 on existing health disparities in communities of color? Nicolette, if you want to jump in on that question as well, because I know you've been dealing a lot with faith communities and not just, sort of the traditional kind of classic Christian faith communities. I know we had Ramadan started yesterday, if I'm not mistaken, Ramadan Mubarak to those on there observing that holiday. So what's that conversation been like?
So I don't think this is distinct from the conversation that we just had with the previous question. All of these things are interrelated. And just putting on my emergency management hat for a second, I think the first thing that we actually have to do is do long-term recovery well. And that is not something that we do in this country. So first and foremost, before engaging, we really have to be clear on what it looks like to have a long-term recovery plan and engage in, and I actually, Ryan, I think this is a wonderful question. I think there are two parts to it, though. I think the first is, what does it look like to have this type of an engagement when you have what we call a prolonged response? So if we think back to 2017, for example, Hurricane Maria, the impact to Puerto Rico and the US Virgin Islands, what you see there is even though it was a hurricane that was a short event, there were about 4 months of a prolonged response that bled into a flu season, that bled into other threats, that bled into mudslide season for them. That is a prolonged response. And part of what you have to be mindful of is the toll that things that happen over months take on communities. There is no such thing as a disaster that happens in a vacuum. It doesn't matter what type of disaster it is. It could be a pandemic, it could be a bioterrorist event. It's going to affect multiple parts of society. But the longer it goes on, the more mindful you have to be of those tolls across those sectors. So first and foremost, focusing on how you support them and not what you're getting from them. So for those faith-based communities, one thing that Healthcare Readies continue to see is that this has taken a massive toll on our religious organizations. They cannot collect weekly tithes. They cannot really do the sick and shut-in check-ins and the outreach that they would routinely do. So before getting information from them, pulling from them, how do you sustain and support the capacity that they already have, but having diminished ability to execute on that? And also, I think it's the same thing as businesses, understanding that their ability to serve and continue to serve the people that they serve in what we call peacetime, in the blue skies when nothing is happening, being able to support them in doing that, whether it's in the response or in the recovery, helps all of us. So how do we reach out to these communities and say, community organization, your tactics might change because you can't do convenings and you can't go door to door because we're in the middle of a pandemic, but your relationships are the same. Your capacity is the same. So how do we help you do that? How do we help you extend that capacity in this current context? And to me, that's a big part of being able to understand where the gaps are, because the more that we can continue to work with those organizations and help them to continue to extend their relationships, extend their capacity, the more we see who's being left out, because it's not going to affect just one of us, but what's going to end up happening is the public health partners are going to get visibility on where those gaps are, who those communities are, if we can better engage and support those existing organizations that have those reaches and have those tentacles into those communities.
Hey, Tara, I'm real curious as well about, because we're talking about communications, and so media features into this very prominently, right?
Right.
And, a lot of people, like yesterday, a lot of people were watching the White House press briefing. I personally don't watch the White House press briefing. I just don't.
Nor do I.
I've been telling my listeners every day, I'm like, just don't waste your time. But it's really crucial. It's real significant to try to separate, the lies from what's really true, to try to sift through that. What role does media play in something like this, as you're looking at it, Tara, and you do a lot of media as well, but what role do you think media needs to play? Journalists, I think that they have to view this differently. They have to view this from the perspective of them being citizens and residents and parents. Sometimes they don't, and people have a problem with that. So what sort of role do they play? What sort of relationship should folks like you on this panel, who are in different spaces trying to lead, what sort of relationship should you have with media? What should you be asking of media so that the right messaging, the right information, the right accurate level of so we can get that kind of reliable information, and we can also look like the trusted leaders that we need to look like? What's that relationship with media look like?
Well, I think there's a couple of ways I want to answer your question. So number one, media needs to take on a role of an adversarial role, because at this point, when we have seen that the president is day after day spreading misinformation, dangerous misinformation, I always say that the media needs to start with the premise that he is not telling the truth, and then vet every claim that is made before publishing something. Even to me, one of the most unfortunate elements is we see headlines, the president said X. And again, I said that earlier, but if people are not having the opportunity to read through an article, that then becomes that statement of a headline or in a tweet or in a social media post, then can spread like wildfire, can spread like a virus, and it can further inflame and foster misinformation. So that's number one. I think the media needs to take on, and we are seeing some folks do that. Yamiche Alcindor, Wegia from CBS. We're seeing a lot of reporters take on a more adversarial role and debunking and fact checking things in real time. And that needs to happen. That needs to continue to happen. The other thing, though, that I think is, and I don't want to beat up on the media, but we need more focus on policy. There is too much focus on politics and not enough focus on policy, which is what impacts our lives. Policy and the failure of policy is what we see with healthcare disparities, is what we see with the racial wealth gap. Those are the conversations that we need to have. And then the other piece of it is we need to do organizations, and so I'm plugging PR professionals like myself, need to engage PR professionals to help you leverage the media to get your message out. And as I said, we specialize, my agency, we specialize in communications for foundations, nonprofit organizations. We represent government. City of Plainfield is our client, Plainfield, New Jersey. So we represent government as well to help government better get its message out. And so, not the most lucrative business model, I'll tell you, but I sleep like a baby. But what's important about the work that we do is it frees our clients up to do what they do, which is the delivery of services. And then what we do is we take moments like this and we work with our clients to produce op-eds, to get their message out into the media, understanding that this is a prime opportunity to do so because people want to hear from vulnerable populations and folks that work with them in a way that they never normally want to hear from them. So the understanding of moments like this and the leveraging of moments like this is important. And then the use of social media to drive movements to change. What we saw was we're seeing corporations returning the money because the spotlight was put on their nefarious ways, and they're taking advantage of the system to the detriment of small businesses that are having actually more impact in communities, right? Because we never talk about the value that barbershop has in the community, because that barbershop in its absence is an empty storefront. And what happens when you have empty storefronts, right? In its absence, that's whether it's 3 to 5 jobs, that's 3 to 5 jobs that don't exist. And in a community that might be distressed, that means something. So these small businesses add value. And so we need to place the spotlight on that value that they deliver. Yeah. And we need to use this moment to do so. And we need to push organizations. The other piece is organizations need to work together. We have one of our clients is partnering with 7 other organizations. So they're to maintain their impact, they're partnering. And so it's not just about partnering to deliver that, but then it's also pushing an agenda together. Because if you're one organization, you don't have the same pull in terms of pushing policy. If you're 8, if you're 10, if you're 12 organizations, now look at the pull that you have to influence policy. So it's the leveraging of the media to put the spotlight on the issues, and also to push public policy change through media and social media as well. So I think that's the opportunity that we have, and that's how we need to be leveraging the media.
And I have another, thank
Charles,
you for that.
Charles,
go ahead.
Charles,
go ahead.
Add something. Let me just add something real quick to that. Everything, Tara, that you just said, I think is fabulous. One other piece I want to add to that, relationships. I think I learned this from you, Charles. When you do have those opportunities to be in the media, call back the producer, send an email back, text back and thank them. And then when you have another idea, send that back to them. I think one of the reasons that I get into the media is because when something bothers me, I'll send a quick note to a producer I've known and say, hey, what about this? Oh, that's okay, Dr. Walsh, can you come on and talk about that? Because that's get the voices from us out in the media. Those relationships matter. Not all the producers look like us, but everybody likes to be told, hey, thanks very much for having me on.
Yeah.
Oh, Nicolette.
Charles, really quickly. I think one of the things we have to be mindful of is how we're burdening those who are carrying the message. As someone who is actively responding to the event, and when I think about Ryan's question about the role of public health professionals, one of the things that is very clear to someone like me is just how tired people are having to both do the work of communicating while actively responding. And so anything that we can do to think about how we build up a cadre of voices, or ways that we can work with the public health officials to be able to amplify messages so that it's not constantly the same people who are doing the work of responding that are also going to be in the position of having to be the thought leaders or the amplifiers or the message carriers is really important, because people are exhausted right now. But also to the question that I see in the chat, this question about how do you communicate? One of the things that I've had to do is pivot away from op-eds and towards radios, toward thinking about how do we carry messages on WhatsApp. I'm a Caribbean girl. My family's from the Caribbean. I can carry more messages with a long text that I send on WhatsApp that can be forwarded through the family chat and to this cousin here and to this person in Jamaica than I could ever do with an article. And so part of what I've had to do is think about how I adjust some of my own messages in my own family in the ways that people are already carrying them. But Harris County is another example of this, where you've got a county that has 8 languages that are equally spoken, and something that they've had to think about as a public health practice, making sure that every document that they create, every social media toolkit that they create, every graphic is in all 8 languages. And if they can't get it in all 8 languages, they don't do it. So we've got to start thinking about how we are doing that, not just in the long prose that we're writing, but in the graphic that goes on Twitter, in the thing that can be forwarded on WhatsApp. How are we making sure that it's in a language that doesn't require that you have 8th grade English language, that you are not a fluent French speaker? What if it's broken Creole? I'm Haitian and Jamaican. I've got to do things in Patois. I've got to do things in Creole. How do we make sure that we are being mindful in our languages to make sure that we're bringing a message that can be received by everyone?
Thank you for saying that too, Nicolette, and just kudos as well to Vanessa Grassi, I think her name is. She was asking that question in the Zoom group chat about best practices for effective communication with limited English proficient residents. And Senator, we lost you for a moment. I'm glad you're back. But talk a little bit about that, expound on what Dr. Lewis Saint was saying, because you're dealing with a district that has multiple communities, multiple Black diaspora communities, Latino communities. It's language competency, language proficiency, cultural competency, multi-community competency is real key here. Talk a little bit about that, about how you've addressed or tackled that challenge.
It's again, it starts with the fundamentals: trusted messages, trusted messengers, listening to and knowing your constituency, knowing your community, bringing other folks in to help. I guess Tara would call it third-party validators, right? People who are, I'm not a physician, okay? But, I know a bunch of them, they're good. I want them to deliver the health message, not me. I want them to deliver the health message because people, again, are competing with so much stuff coming in. The doctor mentioned about me having the IRS, folks from the IRS on. And that was like, wow, do I really want to have someone from the IRS talking to my constituents? Really? And I told the IRS guy before he came into the conversation, I said, yo, dude, I don't usually hang out with y'all. I usually just pay my taxes and just move on, okay? But they are the folks that have kind of like that foundation information on the whole Corona check deal, okay? So, and I got to get my folks the best information, and it's got to be trusted. I know it's IRS, but it's got to be trusted. Right. And the response from my constituents was overwhelming. They wanted to talk to him. He's giving out that Corona check, right? So they definitely wanted to talk to him. But it's fundamental. Trusted messengers, delivering trusted messages. If you got to deal with the diversity issues, the talent is so huge in our community. Let's bring these folks in, give them the space. Every doctor that I reached out to be part of our conversation, all right? Everyone, none of them hesitated. They wanted to be in the dialogue. They wanted to be, yes, I want to talk to the community. I said, well, you just got finished working like 16-hour day, but you still want to do this? They said, yes, I want to do it because our people need to know what's going on. A lot of talent, we got to use it, and the people respond to it dramatically.
Yeah, there's another question too from James Burnett. Tara, he posed this directly to you, but I feel like you can apply this question to a lot of different communities, a lot of different stakeholders. What can businesses do to lobby for the change in policy that you were talking about earlier, Tara? That leads to a larger question about what can certain stakeholders, certain populations, particularly those who are already distressed, low-income populations, for example, those historically disenfranchised Black and brown populations. How can they lobby or advocate? How can they organize in such a fashion? You kind of touched on that a little bit. Let's expound on that, and I'd love to have other folks jump in on this. How can people sort of effectively advocate or lobby for themselves to kind of push through a lot of the noise? For example, we're having this big conversation, we've been having it all week about these so-called protests, which are really like COVID-19 hotspots at state capitals. They're like bioterror attacks. But, it's just a small group of people, but suddenly they have outsized influence on the national conversation about whether or not to reopen. But then here you have larger populations of people in places like Washington, D.C., Brooklyn, Philly, large Black populations, large brown populations in places like Detroit, Chicago, which are getting hit much harder by COVID-19, but it seems like their messaging can't break through. Their messaging or what their demands are or the challenges they're going through aren't being considered as heavily as the Reopen America folks. Talk a little bit about that advocacy lobbying process.
So number one, part of the disparate treatment of protesters, Black protesters versus white protesters is racism, right? The coverage, the outsized coverage that white protests receive even when they're breaking the law, is racism. But we know that, and putting that aside, what can we do, right? And to James, thank you for the question. It is a great question and a necessary and timely question. So number one, I say work with organizations that are already doing the work. I think someone said that earlier, but work with those organizations who are already doing the work. Contact your Black Chamber of Commerce. Contact, if you have an organization, an urban league organization in your community that's particularly active. Find those ones that seem to be particularly active and effective in doing the work, and then work through them, because what they will have for you is they will have communications professionals. If they don't have them on retainer in the form of a business like mine, they'll have a committee, a communications committee, and they'll provide you with social media graphics so you don't have to do that work. All you have to do is post it, put a quick commentary from yourself, and just add to the voices, because it's about voices. And rule number one of government, I worked in government. Before I started my business, I was director of appointments, meaning appointments to boards and commissions for the state of New Jersey, for the governor of New Jersey at the time. And one thing I learned working in government was, well, I learned many things, but the one thing I learned is the squeaky wheel gets the oil. So you have got to be the squeaky wheel. Do not let, what people will try to do is shame you and to stop you from being the squeaky wheel. That means you're doing something right, because they want to silence your voice. So don't let anyone silence you. You have to be persistent. You have to be that person that shows up at the town meetings. And so the persistent message, and you can save some of your bandwidth, because we're all busy, especially if you have a business. I'm extremely busy. If you have a business, you're busy. But you can utilize, again, the resources of organizations doing the work, so you can be that squeaky wheel without putting a lot of pressure on yourself. So that's number one. Number two, there are opportunities to testify. Make sure you go on the websites of various, your city website, your municipal website. Go on the website, see when those council meetings are taking place, those legislative meetings are taking place, and testify. I testified myself recently about how to ensure, this is pre-pandemic, but this is valuable for this time. Some of these opportunities are available online now. Some governments are holding meetings where you can testify for sitting right at home from your home office, or sitting at your desk in your living room, whatever, in your bedroom. So testify when the opportunity presents itself. Some people think testifying doesn't matter. It does matter, because what will happen is people who may not have our interests at heart are going to show up and testify. And they're going to show up to advocate for what they want. So I testified about raising the cap for government being able to give contracts out without going to an RFP process. I don't want to get too far in the weeds, but basically I testified because Black businesses tend not to get as many contracts, because going through the RFP process to get a contract with government is extensive. It's time consuming. It's really challenging. So I testified to say, in New Jersey, let's raise the amount of money that to make it to, I think I testified $200,000, right? With that, you just have to submit a quote to government. Government just needs 3 quotes, not an RFP. And that will allow more inclusion of Black-owned businesses, Hispanic-owned businesses, women-owned businesses. So that was my testimony. And I know for a fact that the state of New Jersey is actively looking to raise those caps. In the absence of those of us not showing up to offer the testimony, and I had people come up to me afterwards and say, elected officials that said, policymakers will tell you, I did not know this. And we shouldn't expect them to know everything, because they're not living our lives. They're not, if they're not living our reality, we have to educate them on our reality. And they were excited to be able to make these adjustments. And then we gave them what they needed to justify, because the media was present. The media then wrote about the disparities. The media then wrote about the solutions. So participate in those type of things. And if you are a part of any of these organizations, a lot of times they will know about these opportunities, the good organizations. So vet the organizations that you're going to be a part of to make sure they are active. They are good organizations, because you don't want to waste your time. And then, but also do the work yourself to look at these opportunities, and then band together with other small business owners and push.
To get
call
that
the elected officials, and don't just call the ones who are opposing you too. Call their offices too.
Well, we got about a few more minutes, several more minutes of this session. Really appreciate everyone, their insights and their time and their patience as well. I have a question too about social media, and Nicolette, you made this observation. We're having an offline conversation recently about how this is the first pandemic we've had with social media in the mix, and which that has its upside. There are benefits to that because you can disseminate information and conversation discourse more easily, more fluidly, but it obviously has its drawbacks, right? There's a big downside because it also disseminates misinformation. How do we like, and I'll throw this question, you can start on this, Nicolette, and if everyone else wants to jump in while we've got a few more minutes. How do we not get like trapped in the rabbit hole of social media, right? Because on one hand, you want to engage it, you want to utilize it as a tool to get that message out. But on the other hand, you don't want to get trapped into disputes or getting so caught up in trying to push back against the misinformation. That can end up taking up a lot of time and bandwidth and burning cycles, right? How do we balance that? Nicolette, have you start on that?
Sure. So I think from my vantage point, I think, the disputes, the battles, all of that, that's a waste of time. But what we do have to think about is when you do have a pandemic with as much interconnectedness as we have right now, good information can travel as fast as misinformation. And so what the charge is making sure that the good information, the credible resources are as readily available, digestible, and on the same platforms that can move as fast as the misinformation. And so above all, it's about making sure that that information in those digestible packets is available so that it can counter the speed at which misinformation is moving through, especially communities that are more vulnerable to COVID. And so when you're thinking about how to manage it, I don't think this is about just on the individual level. I'm not arguing with anybody about how I feel about COVID. It's a pandemic. It's not about my feelings. That's not the conversation that I'm having. But I do want to make sure that every time there's a question about is 5G related to COVID, the answer is no, right? And it's no, here's what this is, here's what this isn't. And making sure that we can have places where the real information about the disease, about how to avoid it, about how to prevent it, about what to do to get tested, those things have to be, again, as quickly traveling through social media as the misinformation, because what we're seeing is, especially in a pandemic, it's not just about misinformation in the US. It's about what's traveling globally, because there's a lot of information that's coming from misinformation campaigns in France. If you remember about a month ago, there was a question of whether or not you could use NSAIDs, right? So non-steroidal anti-inflammatory drugs, ibuprofen, acetaminophen. Could you use NSAIDs with COVID? That was misinformation from France that made it to the US. So we have to make sure that the information that we're disseminating is on the same platforms as the misinformation. And we also have to work with the tech companies, the social media companies, to make sure that they have misinformation campaigns so that they are also identifying misinformation and removing it from their platforms. And I'm seeing that Facebook and Twitter and a few others especially are really leaning forward into that. But that's another part of this, is making sure that we have a process to identify something, mark it as misinformation, and work to remove it from the platforms as well.
We actually ran on time. I don't know if anyone else wanted to jump in. I can give us a few more minutes. Dr. Walks, Senator Hughes. All right, excellent.
Nothing better than what I just heard.
Well, we're going to go ahead and head into concluding our micro summit. Thank you for those last words, Dr. Lewis-Saint. You just heard Dr. Nicolette Lewis-Saint. She is Executive Director of Healthcare Ready. I want to thank you too, Nicolette, for partnering up with the Council of State Governments Eastern Regional Conference to make this micro summit possible. Really appreciate that. So you'll get the last word. She's been joining us here on panel. Go to @Dr. N. Lewis-Saint to engage her on social media when she's available. But you also are giving some really great tips and also information and advice there on Twitter when you are there. Thank you. Also, Dr. Ivan Walks is principal also founder of Ivan Walks and Associates and former chief medical officer for the District of Columbia. You can go to at Ivan Walks, I believe, on social media, on Twitter more specifically when he's there, or ivanwalks.com for more information on Ivan Walks and Associates. Thanks so much, Dr. Walks. Tara Dowdell, founder principal of the Tara Dowdell Group. Go to taradowdellgroup.com for more information, at Ms. Tara Dowdell as well. Wonderful having you, Tara. Really appreciate this as always. And State Senator Vincent Hughes, representing the 7th Senatorial District in the Commonwealth of Pennsylvania. Go to senatorhughes.com. You can engage him on social media when he's there, at Senator Hughes on Twitter more specifically. You all have been great. You've been wonderful. We actually could go on for another hour, but people have got things to do.
Charles,
we've got a crisis. Go ahead.
There's an important point that I want, and this is policy and opportunity, all right? Policy and opportunity. In the $2.2 trillion that's come down to the states, there are some significant amounts of dollars that are discretionary, that the states have some discretion in terms of how they spend it. It's not all prescriptive from the federal government. There are some discretionary dollars. If we are moving to a reality where most of our interaction is going to be virtual like this, I think we have a policy responsibility to try to use some new dollars to try to get access to social media, access to the internet available to communities that have been locked out, either geographically or locked out economically. And so if there are discretionary dollars coming in, we're moving to a more virtual world. Let's work with our policymakers to get a significant portion of those dollars going into communities to get everybody online, to get everybody interconnected, if we're not going to be able to socially gather for quite some time.
It's just like Tara said earlier, focus on the policy,
Yes.
Get out of the red state versus blue state, Democrat versus Republican political arguments. If we focus on the policy, see, a lot of folks don't realize that. They don't know that. Well, people in this audience do, and I'm sure they're going to spread that information as well to their colleagues and to their networks. Want to appreciate everyone in the audience for listening, for watching us, and also for your questions in Zoom group chat. We will continue the conversation, however, at #HealthcareReady. And also #CSG COVID-19. Thank you, Martin Pratt, as well. He's been on the back end providing technical assistance. He's a fellow with CSG East, as I'm also a fellow as well with CSG East. Want to thank them. Healthcareready.org for more information, CSG-ERC.org for more information. Thank you, Debbie. Really appreciate you as well. We'll continue the conversation. This video, this recording will be provided very shortly, very soon, at the benote.com, the benote.com. It will be made available so you can share it with your networks, and also so you can also reference it if you want to go back to the conversation and take notes from there. I'm Charles Ellison. You can reach me at Ellison Report on twitter.com, #RealityCheck as well, or listen to me on WURD Radio every Monday through Thursday at 10 a.m. to 1 p.m. Eastern. You can live stream us as well at wordradio.com. Thank you, everyone. Have a wonderful rest of the morning, rest of the day. Please stay safe. Enjoy yourselves and your families. And we will see you at the next Micro Summit here on CSG East Healthcare Ready. Thanks so much again. Take care.
Thanks, everyone.
Bye.
Bye-bye.